Right. Getting ready for that big nursing interview.
Oh, I bet you are.
I know those interviews can be,
And nerve-wracking.
yeah, totally nerve-wracking. But don't worry, don't worry. We've got some good news today. We're diving into this super helpful article called 44 Registered Nurse Interview Questions and Answers.
44.
Yeah, 44. To help you totally nail it, you know.
And you know what I really like about this article?
What?
It's not just about, like, memorizing answers, you know? It kind of helps you understand, like, what the interviewer is really looking for.
Yeah.
It's like, you get to peek behind the curtain.
Totally. It's like having that friend, you know, who gives you the inside scoop. Okay, now.
Like the cheat sheet.
The cheat. Okay, now we all know about those, like, general questions, right?
Oh, for sure.
The ones they always throw at you.
Yeah.
Tell me about yourself. Why nursing?
Those ones.
Those kind of things.
They can feel a bit generic, but it's your chance to make a good first impression.
Yeah, for sure.
You know what I thought was really interesting is that the article talks about how you should tailor your responses to the specific hospital.
Okay, yeah.
So, for example, when they ask you, like, why do you want to work here? You shouldn't just say, like, oh, I love to help people, you know?
Right.
That's just, like, so generic.
It's like showing up to a potluck with a bag of chips.
Exactly. Like, come on.
Come on, put some effort in.
Yeah, exactly.
Do your research. You got to do your research.
Yeah.
What really stood out to me was how the article really encouraged, like, you to connect your values to the hospital's mission.
Yeah.
So, like, if the hospital is really big on, like, community outreach and you volunteered at a free clinic or something, bingo. That's a match made in interview heaven.
You got it. Shows you've done your homework.
Yeah.
You're genuinely interested in their team, not just any nursing job.
Any nursing job.
Yeah.
And speaking of showing who you are, let's talk about that dreaded question.
Oh, yeah.
What are your weaknesses?
The article actually gives an example. It says, I can be overly critical of myself.
Oh, yeah. That's the classic. Like, everyone says that one.
Totally.
But wouldn't it be more impactful
For sure.
to show, like, genuine self-awareness?
Yes, absolutely. Instead of, like, trying to dress up a strength as a weakness.
Right.
Use this as an opportunity to highlight, like, your growth mindset.
Oh,
Talk about, like, a time you made a mistake and what you learned from it.
Okay, yeah.
It shows humility and a desire to learn, which is so important in nursing.
Absolutely, because you're constantly learning. Right?
All the time.
Yeah. Now, you know they're going to hit you.
Oh, yeah.
The clinical questions.
For sure.
I remember prepping for my first nursing interview. I was like, oh, boy, here comes the real test.
It's like the gauntlet.
Yeah.
But, you know, the article talks about how important it is to stay updated on, like, medical practices.
Oh, okay, yeah.
It mentioned, like, attending courses and reading journals, participating in workshops, things like that. But think about it. What really matters is how you actually apply that knowledge.
Right, so it's not just enough to, like, rattle off a list of journals you read.
Exactly.
You got to connect the dots.
Connect the dots, for sure.
Like, what's a recent medical breakthrough in your specialty?
Yeah.
How would you apply it to patient care?
That's the kind of thinking that really impresses interviewers.
Okay, yeah.
Now, another question they might ask you is about medication safety.
Oh, yeah.
And I don't have to tell you.
That's serious business.
Serious business.
No kidding.
Not just about knowing those 5 rights.
Right.
It's about having that laser focus and double-checking everything.
Yeah, speaking of the 5 rights, is there one that you've seen nurses struggle with more than others?
That's a good question. You know, it's interesting because remembering the steps, that's not usually the issue.
Right.
The challenge comes from, like, the pressure of the situation.
Okay.
For example, I've seen nurses miss the right documentation because they were juggling, like, multiple patients and they got sidetracked.
So it's about showing that you understand the pressures of the job and how to stay organized even when it's chaotic.
Absolutely. You got it.
Okay, now let's talk about when things don't go perfectly.
Yeah.
Because let's face it, in nursing, things don't always go as planned.
Right. It's about owning up to your mistakes and showing what you learned from them.
It's that whole growth mindset thing again.
Right.
Exactly. Showing that you can learn from those tough situations.
Right.
All right. Now, for the part of the interview that always makes my palms sweat.
Oh, tell me about it.
The behavioral questions?
Yeah.
So it's like they're trying to peek inside your brain and see how you tick.
Well, think of it this way. You know, these questions are helping them understand how you'd handle real-life situations on the floor.
Gotcha.
Can you stay calm under pressure? Can you problem solve? Can you communicate effectively?
Yeah.
It's all about showcasing those soft skills.
Those crucial soft skills.
Exactly.
Yeah.
Is super important.
The article gives some pretty intense examples like,
Oh, yeah.
what do you do if you have a difficult patient who's refusing treatment?
Ooh, that's a tough one.
Or if a coworker is, well, let's just say, not pulling their weight.
Right.
What do you do?
And this is where things get really interesting.
Okay.
It's not about having the right answer.
Okay.
It's about showing your thought process.
Oh.
Or can you demonstrate empathy for that difficult patient?
Right.
Can you address that coworker situation professionally and with a focus on teamwork?
Okay.
It's all about showing those critical thinking skills in action.
One example that really stuck with me
Yeah.
was about a nurse who went above and beyond for a patient. She stayed after her shift
Wow.
to help a lonely patient connect with their family through video calls.
That's amazing.
It's those little things that make a huge difference.
Absolutely. And it shows that you understand that nursing is more than just tasks and procedures.
Yeah.
It's about that human connection, that compassion,
Mm-hmm.
treating the whole person, not just the illness.
So when you're prepping for your interview, think about those moments where you went the extra mile
Yeah.
for a patient or a colleague,
For sure.
because those are the stories that set you apart.
Right. And those stories really highlight your values.
Yeah.
You know, they give the interviewer a glimpse into who you are as a nurse and as a person.
That's a human.
Exactly.
Yeah.
Now, beyond those tough scenarios, the article also dives into teamwork, patient care,
Yeah.
and ethical considerations.
I mean, those are the cornerstones of nursing, wouldn't you say?
Absolutely. And these topics might not be presented as like questions in the traditional sense.
Gotcha.
They might just be woven into the conversation
Okay.
as the interviewer gets a feel for your overall approach to nursing.
So how can our listener prepare for that kind of subtle questioning?
Right.
It's not like they can memorize answers from a textbook.
Exactly. Well, one thing that comes up consistently in the article is the importance of clear communication.
Oh, okay.
Whether you're talking about collaborating with doctors, explaining procedures to patients, documenting care,
Right.
communication is key.
So think about those times where you demonstrated strong communication skills,
For sure.
right? It's not just about being a good talker.
Right.
It's about being a clear, concise, and accurate communicator,
Absolutely.
especially in a high-stakes environment like healthcare.
Couldn't agree more.
And, of course, patient care is at the heart of everything we do as nurses.
Definitely. And this article touches on some sensitive aspects of patient care, from confidentiality to end-of-life care.
So how can our listener demonstrate that understanding in an interview setting? Is it about knowing specific policies?
Okay.
Or is it more about conveying a certain attitude?
Well, it's a little bit of both.
Okay.
Of course, you should be familiar with like basic patient rights, ethical guidelines.
Yeah.
But what really shines through is your genuine concern for patient well-being.
Okay.
Think about times when you advocated for a patient's needs
Yeah.
or helped them feel more comfortable and empowered in their care.
Now, speaking of tough situations,
Yeah.
the article brings up ethical dilemmas. Those are bound to come up in any nursing career, right?
Oh, absolutely.
And it's not always clear cut.
Right.
Right. It's about navigating those gray areas and making tough decisions while advocating for your patient.
Yeah.
I imagine interviewers use these questions to kind of gauge your judgment
Oh, for sure.
and integrity.
They want to see that you can think critically, weigh different perspectives,
Right.
and ultimately make decisions that align with ethical principles and patient well-being.
Okay.
And remember, even seasoned nurses
Yeah.
face ethical challenges.
Right.
What matters is demonstrating a thoughtful approach
Mm-hmm.
and a willingness to seek guidance when needed.
To learn, yeah.
Exactly.
Okay, so we've covered a ton of ground here.
We have.
From general interview tips to clinical scenarios, behavioral questions, ethical considerations.
It's a lot.
Whew. This article really does do a great job of prepping you
It does.
for that interview hot seat.
But remember, it's not about
Yeah.
memorizing answers or
Right.
trying to be someone you're not.
Right. Be yourself.
It's about showcasing your authentic self,
Yeah.
your passion for nursing, and your dedication to providing excellent patient care.
All right, so let's wrap things up with some practical advice on how to actually ace that interview.
Yes. Love it.
The article have a whole section on preparation
Mm.
appearance, making a killer first impression.
Important stuff.
I remember from my first interview,
Yeah.
I was so focused on the questions
Oh, yeah.
that I almost forgot about the basics.
The
Like,
little things.
yeah,
The little things.
it's easy to overlook those when you're nervous,
Oh, for sure.
but they matter, you
Yeah.
know? Dress professionally,
Yeah.
arrive on time,
Yes.
and for goodness sake, turn your phone off.
Yeah, airplane mode.
Airplane mode, exactly.
These things show respect and demonstrate that you're taking this opportunity seriously, for sure. And what about demonstrating that passion for nursing?
Yeah, good question.
The article talks about sharing personal stories and staying updated on industry trends.
Right.
But it's like, how do you weave that stuff into the conversation
Yeah.
without sounding like you're bragging
Right.
or giving a rehearsed speech?
It's all about finding those organic moments
Okay.
to connect your experiences to the conversation.
Okay.
So, for example, if they ask you about your career goals,
Mm-hmm.
you could talk about a recent conference you attended
Yeah.
and how it sparked your interest in a specific area of nursing.
Oh, okay.
Or if they ask about a challenging patient interaction,
Right.
you could share a story that highlights your compassion and resilience.
So be prepared with those anecdotes.
Yeah.
And just find natural ways to weave them in.
Exactly.
Now, let's be real. What if you get a question and you just blank?
Oh, yeah, the dreaded brain freeze.
Yeah, what if you don't know the answer?
It's bound to happen.
Right.
And it's okay.
Okay.
The article emphasizes honesty and a willingness to learn.
Okay.
If you don't know the answer, acknowledge it gracefully.
Right.
You could say something like, "That's a great question, and I'm not entirely sure,
Yeah.
but I'm definitely eager to learn more about that."
It's about turning that, I don't know, into a positive.
Yeah.
Right?
Sure.
Showing that you have initiative and a growth mindset. Absolutely. And speaking of initiative,
Yeah.
don't forget to come prepared with your own questions.
Oh, yeah.
For the interviewer.
It shows that you're engaged.
Exactly.
Yeah.
The article suggests asking about things like the nurse-to-patient ratio, opportunities for professional development, or
Yeah.
the team dynamics on the unit.
So you get some insights into the
Right.
work environment.
But it also shows that you're thinking beyond just getting the job.
You're thinking long term.
Exactly.
Yeah.
So what does all of this mean for you, our listener?
Yeah, great question.
We've unpacked a lot today.
We have.
But the key takeaway is this
Okay.
preparation,
Yeah.
authenticity,
Be yourself.
and a genuine passion for nursing.
Yes.
Those are the keys to acing that interview.
Don't try to be someone you're not.
Mm-hmm.
Let your personality and your dedication to patient care shine through.
Exactly.
And remember,
You got this.
you got this.
You've worked hard to get to this point.
It's
And you have valuable skills and experience to offer.
Before we wrap up, here's one final thought to ponder as you prepare for your interview.
Okay.
Take some time to reflect on your own journey.
Mm-hmm.
Think about the situations you've faced that showcase your strengths, your values.
Yeah.
What are the stories that you can share that will make you stand out? By digging deep and connecting with your own experiences,
Right?
you'll walk into that interview with confidence, knowing that you have a unique story to tell.
That's so powerful.
Good luck out there, you future nursing superstar.